The doctor is in. It's been 1 year since the start of the pandemic, which has brought a tremendous amount of heartbreak and loss, as we all know. Heartbreak is real, and emotional stress can cause heart problems and even death from heart attack. Joining us is cardiologist Dr. Stephen Sinatra of Healthy Directions. He is the author of Heartbreak and Heart Disease. Welcome to Bloom, Doctor. Thank you so much for joining us.
Oh, it's great to be here. Thanks so much.
Tell our viewers about how heartbreak is real. Explain as a cardiologist.
Heartbreak is real. In other words, if you suffer a heartbreak, like the loss of a loved one, especially if it's a vital connection in your life, what happens is that the autonomic nervous system creates a surge, and we get adrenaline outpouring, noradrenaline, cortisol, the hormone of vigilance, and all these hormones can interact. They can cause the heart vessels to go into spasm. They can cause the heart to go into arrhythmia. Blood pressures can soar, and it can create really undesirable physiological circumstances in the body. So emotional stress, I can tell you from being a cardiologist for decades, emotional stress is really real, and it really comes right inside our hearts. So we have to be really careful about such situations, and the best thing to do is really acknowledge them, cry it out. There are so many things we can do to alleviate the heartbreak because we don't want it to lead to heart disease.
Unfortunately, Doctor, we've had more than our share of emotional stress this past year as we mark the anniversary of the start of the pandemic. How have you noticed that the pandemic has impacted heartbreak?
Well, one of the things the pandemic has done is that it's created a situation of us being trapped. In other words, look at some of these poor kids throughout the country. They're athletes. They can't play football. They're confined to the home. And whenever you're confined, and you don't go outdoors, or you don't go shopping, you don't go to restaurants, you don't go to church or synagogue, you lose these little vital connections in your life, and you lose the things that give you joy and happiness. And when this happens, depression can occur, and that's one of the reasons why we're seeing teenage suicides, and we're seeing breakups of marriage, we're seeing overabuse of drugs and alcohol. So the pandemic has created a big situation where our emotions are soaring right now, and what we need to do is really feel our emotions, get into our emotions, and discharge those biochemicals, which can have, like I said before, an incredible adverse effect on the heart.
Please tell us that you're seeing a light at the end of the tunnel, because we really need some good news, Doctor.
Well, yeah, there is light. I mean, certainly more and more people have had the virus, and herd immunity is around the corner. The vaccination situation is occurring right now. People are getting more outdoors now because of the warmer weather, especially in the Northeast. Remember, this virus and temperature has a connection. So basically, with all these things coming together, I'm very optimistic. I am optimistic that by this summer, I think America is going to free up, and people are going to feel better about themselves. They're going to be networking with one another. And whenever you network with people, you literally get your life back. I can tell you that as a heart specialist.
Gosh, I hope you're right about your prediction. But in the meantime, while we're still dealing with some of these things that you talked about, can you offer us some tips that can help with heartbreak and loss?
Oh, absolutely. The most important thing that anyone can do when they're suffering heartbreak is not stifle the emotion. You do not want to hold in your anger, hold in your sadness, and certainly not your tears. Once you do that, you're driving your car with your brakes on, because what's happening is that the surge of chemicals and biohormones in the body, it's literally taken over the body. So my best remedy is, if you're feeling sad, please be sad. I mean, cry it out. Crying is the best thing we can do to release the heartbreak that will lead to heart disease. And by the way, when we cry, our tears have endorphins. And these endorphins are feel-good hormones. And basically, they come out of the eye. Also, when you cry and you sob, you're increasing oxygen delivery in your lung. And there's biochemicals, cardiologists call it thromboxane A2, a fancy name, but basically, those chemicals tend to get dissolved. So crying has a physiological and a biochemical impact on favorable aspects of the heart. It's absolutely essential, and especially in this epidemic.
That is fascinating. Crying is good for you. Crying is the doctor's prescription. That's phenomenal.
Absolutely. When you hold that feeling in, bad things happen.
And so it's important, I guess, too, to have someone that you can let it out with emotional connection, I assume, is a big part of it?
Oh, yeah. In other words, any vital connection. You know, in my line of work, I saw a lot of death in my years because of the nature of my specialty, heart disease. And even when, you know, people have been married 30, 40, 50 years and they lose a loved one and then their kids are away or they didn't have children, pets, dogs and cats were life-saving in my patients. And I used to tell my patients, if you're loneliness is the greatest sin. There's no doubt about it. When people are lonely, bad things happen. But I would tell my patients, you know, go to an animal shelter, look at a cat or a dog, and if they choose you, and if they make you feel good inside, please adopt a pet, because once these pets give you unconditional love, it reestablishes a vital connection, and that love absolutely heals the heart. Now, I'm talking more like a psychotherapist as opposed to a cardiologist, but that's my training and that's my strong belief.
Hey, you're right. I love every single thing you said today. Dr. Sinatra, thank you very, very much. And,
thank you.
And for more information, visit Dr. Sinatra's website. Very simple, drsinatra.com. We'll be right back with more Bloom right after this.